Hi everyone, I'm Ashley Adamson and this is Dr. Keojampa. Welcome to our second episode of my podcast series called Transform. We talk about heroic narratives of people who transcend the shape that they're given, and we talk about the challenges and victories that they've had in their journey. We have a special guest today. Dr. Keojampa is a world-renowned FFS surgeon as well as aesthetician around other surgeries. And I just got my chin done by him on Monday and thought it would be really cool if we could do an interview. So here we are, a little less traditional of what I would say is maybe a different angle of the trans story and narrative. And I just really want to dig into some of Dr. Keojampa's history and past as well, because he's got a pretty untraditional past. So with that, let's kind of begin with some of my first basic questions. Are you ready?
Yeah, never ready, but I'm ready to get started.
So I have some really basic questions,
Okay.
and you can answer these however you want, and that's sort of the intention.
Okay.
I'll list them all out, and I'll kind of ask you one at a time. Who are you, what are you, and why are you here are kind of the three questions. So with that, who are you?
That's a good question. Now, I think one of those important things for me is, I think I'm a father first. I have 3 young kids. So I have 2 girls and I have a boy. It's actually been fascinating to watch them grow up. And you actually can see how, they actually understand gender very early on. And I also see them in the lens of kind of also patients I treat. And I do see how, gender is formed fairly early. And it's important to kind of understand, how that develops since, I do work in the transgender community.
Mm-hmm. Cool. And what are you?
What am I? I'm a surgeon, so that's a big part of, my life. It's interesting in that I've always known that I was going to be a surgeon. From the moment that I was, from my earliest memories, is even early as 3.
Really?
Yeah, so it's just like a lot of my patients will tell me they've known they're transgender since they're 3 or 4 years old, but I've known since I was, as far as I can remember, that I was going to do something with surgery. I did grow up in a privileged background because I came as an immigrant, but my father was, a surgeon in the country in Laos, where, we immigrated from as refugees, and just growing up with, seeing him do those things, it kind of has made me pursue, medicine and surgery.
Wow. Okay, so you knew when you were a child?
Yeah, it's crazy.
What's your earliest memory of kind of knowing this?
Well, I remember actually seeing my father do things at the hospital, and, he would take me on rounds to the hospital when I was young. And this is back in Laos before the war broke out and everything. Seeing that, for some reason, that just stuck with me. I'm actually the only person in my family besides him who went into medicine, surprisingly. Wow. But those early experiences did shape, my life. And I'll have a lot of friends, who go through medical school, and they'll say, hey, I decided midway I'm going through medical school. I've known since I was 3.
That's crazy.
Like a lot of my patients, right? They've known since they were young, 3 years old, that there's something wasn't quite right with their body.
Mm-hmm. Mm-hmm. Yeah. That's amazing. You are destined to be a surgeon.
Yeah.
Okay. And why are you here?
Why am I here? That's again a very difficult question, but I guess I'll answer it more literally. So, I did all my training in Boston, and I came back out to Los Angeles when I went to college because my wife, she's a cancer surgeon, so we're both in medicine, and so we moved to Los Angeles for my wife to pursue training in cancer surgery, and then I was in Los Angeles for quite a long time. And then my wife was offered an amazing job opportunity in San Francisco as a cancer surgeon. So at that point, we decided to move up to San Francisco for her to pursue that job. And it was a really easy choice to make since when I looked at my practice, most of my patients were not from Los Angeles anyways.
Oh, okay. So
we moved up here, and that's actually why I live in the San Francisco area now. That's also why I have 2 offices in San Francisco and Los Angeles. Some people joke that when I moved up here, they joked that, I'm trying to take over the world because I have all these two big offices, obviously, in Los Angeles and San Francisco. But it became basically of necessity, for my wife to pursue her career path. And then it also allowed me to expand to San Francisco.
Mm-hmm. And where are most of your clients from?
Basically everywhere, all over the United States, all over Europe, Latin America, just basically just about everywhere. I mean, this past week, we've had patients from Canada, Australia. We have a patient coming from New Zealand. When you had your surgery, you were in Berlin. I had a patient from the UK recently. And actually, it's nice when you meet those patients because you have these little things that you connect with each one. I had a patient from Italy, and I spent, I lived in Italy for an entire year when I was in college. So it was kind of nice to connect. And there's always, even though you're far away, you make these important connections.
Mm-hmm. Moving things along a little bit more, you answered those questions brilliantly,
okay.
by the way. Let's talk a little bit about kind of like where you started on your journey to where you are now.
Mm-hmm.
Where does that start? Does that start from when you're a kid and that you're, as a refugee, you're forced over here? Or does that start in medical school? Or how, like, where do you feel like you as your hero's story, where does it begin?
Yeah, I think everything happens for a reason. As tragic it was for the Vietnam War to break out, the explosion in Laos, if that didn't happen, I honestly would probably still be in Laos right now. So I came to the United States as a direct result of, that war that happened there. So I think everything happens, for a reason. And then with my father being a surgeon, that I was able to get early memories of that, and it really stuck in my head. But when we came to the United States, obviously as a refugee, you have nothing. So you have to kind of make your way. And I was really the first person in my family to go to college, and I had to kind of navigate through. I just knew what the end goal was. I knew that I was going to be a surgeon, and I just had to figure out some way to do it.
Right.
Early on, I like to do things with my hands, and I didn't know what type of surgery I was going to do. I just knew in my head that this is a pathway. And that's basically where it started. And things kind of fall into line. I mentioned to you I had a personal friend when I was in college that came out later as transgender, which I didn't know until much later. And I never pursued plastic surgery per se. I thought I was going to be an orthopedic surgeon. But then, when I went to medical school, I realized that there was this artistic part to plastic surgery. And by fate, I happened to do training in Boston in a world, renowned center that did facial feminization surgery. And, back then, about 10 years ago, a lot of doctors or even people who hadn't interfaced with a lot of transgender people or patients were really hesitant to kind of engage because they didn't know or understand that patient population.
Mm-hmm.
So when I was able to, work in Boston and be able to interview a lot of, my trans patients, I realized that they were just exactly like me, actually.
Mm-hmm.
Had the same interests, and really their main concern or issues was their gender. We would connect over, music and things like that. I would have my patients had very similar interests or, aspirations and ambitions like myself. But the only thing that was really off was their gender. And, for a lot of doctors who don't work in the trans community, they think there's this psychological or issue or problem. And I actually don't find that at all in my trans patients. I mean, my trans patients are exactly like me, except the gender that you were born in doesn't really fit. And I tell my staff how to think about lots of our patients is, you wake up every day. For example, I wake up every day and I'm very happy to be a guy. I don't think, if I woke up every day and I was the opposite gender, I'm not sure how happy I would be.
Mm-hmm.
A lot of my staff members also. So, I'm lucky in that, I don't have gender dysphoria, but if you woke up every day was the opposite gender of how you perceive yourself, and see that would cause a lot of distress.
Yeah. The way that you're describing it is really interesting because it sounds sort of like the way I visualize it is it's sort of like there's this wall.
Yeah.
And these patients are like, hey, there's this wall between me and the rest of the world. Yeah. Can you just help me break this down for me?
Yeah.
Yeah.
Yeah, it's actually interesting. One of my patients, she's an attorney, And she actually put it what it feels like to have gender dysphoria. Actually, it really stuck with me. Where she said, she was talking to one of her cis girlfriends, and she asked her cis girlfriend, "How often do you think about your gender?" And her girlfriend said, "I don't ever think about my gender." And my patient who's transgender, she's like, "I think about my gender every day." Like she said, every time I do something, it's a constant reminder that how I think and about myself. It's a reminder that someone else sees me differently. And interesting enough, I was able to interview with her. She's almost a year out from surgery, and I asked her, "How often do you think about your gender?" She said, "I don't."
Oh my God, that's amazing.
Yeah. So, she, at this point in time, she's always gendered as a woman. She's a practicing attorney, and everyone sees her as a woman. So there's not this constant reminder to her that how she perceives herself and how the outside world, how it's incongruent. So it is fascinating to see that she does not really think about her gender anymore.
Yeah, I feel like the same after I had surgery from you last year.
Yeah.
I was like 100% passing, and then I just never had to think about it anymore.
It just makes it less. I mean, now you can focus other parts of your life, And actually, I had a very amazing interaction with a patient of mine just 2 weeks ago. She had a really amazing result. She's like, "I'm ready to go live my life now."
Isn't that great?
Yeah, it's awesome. Yeah.
That must feel very rewarding to be a part of that process.
Yeah, it is amazing because you have patients that are extremely happy. It's such a rewarding, specialty to get into. Like I said, I never sought it out specifically, and things happen for a reason. Like I think every step of your life that occurs, there's some reason why that happens.
So this, for a reason, like how this happened, how exactly did you end up doing trans-specific FFS surgery? What was that jump from being, I want to be a surgeon, to I want to do FFS surgery specifically?
It happened to be the right place, right time. I was in Boston, and there was Dr. Jeffrey Spiegel, who's world renowned doing facial feminization surgery. He was one of the busiest in the world, and just being able to interact with his patients and just to see the motivations, their ambitions, and then just seeing this like huge transformation from someone who wasn't happy to someone who was extremely happy. And I noticed when people are happier, they tend to be more productive and live their life in a much more enjoyable manner. And the surgeries also are very technically challenging and very intricate, but also at the same time, actually very dangerous. So if you don't train with someone specifically to do the surgery, these surgeries actually have very high risk. But if you've done the proper training, it's actually very safe. Right before I had talked to my patient, which I did surgery on yesterday on Friday, and I told her, I have not had a single major complication in over 10 years. And that was just a product of a lot of, training and being able to know how to do the surgery safely. So a lot of it comes with, experience, and then I got the fortunate ability to train under, a world expert that had a large, experience in these patients and these cases. Yep.
Yeah, it's really funny you mentioned the experience part, because that for me was also the thing that kind of helped me get through the fear of getting this surgery. Like last year, when you were telling me you were basically going to cut off a part of my skull and then shave it down, like my brain's going to come out, you're like, don't worry, I do like 3 of these a week, and it's all fine. And really, when I just think about the quantity that you've gone through and the experience that you've had with it, it's probably almost like subconscious at this point for you to just be able to do the moves that are required to make it happen.
It's really fascinating. I don't get nervous about surgery at all. I think when I first came out and practiced on my own, you're still kind of finding your way, even though you train with someone who's well known. But at this point, I don't really get nervous about surgery. I just have a very clear vision about what I'm going to do, and I know that you're going to have a good outcome. That's how I think about the surgery. And like I said, complications are really exceedingly rare if you do a lot of it, and just being meticulous with surgery, but also just understanding what limitations are, so that way you don't cause complications. But also, even after I finish my training, there's a constant evolving process of trying to get better, do things better, be more efficient. Since I finished, there's certain procedures I've developed on my own But also, I have some patients who see me and they're really excited about the consult, and then in the end they realize, I'm booked out like over a year for surgery. So what I'll tell patients is, in a year from now, you're going to get a better surgeon. I'm going to have one more extra year of experience.
So book it now. Oh my gosh. Wow. We talked a little bit about how you trained under Dr. Spiegel, right?
Mm-hmm.
And how that kind of exposed you to FFS and then going down that path. But when you first started out, did you have any doubts in your own mind about if you could actually do it? Were there things that you were afraid of that you may need to confront to kind of move through this process?
Yeah, that's a really good question. I think a good way to kind of explain is, when I meet a lot of my patients who are transgender, their sense of gender identity is so clear. They see themselves, that they, I'm a woman, and it's really clear. Same thing actually with surgery. Like I knew from the moment I was 3 years old I was going to become a surgeon, and I never really felt hesitation, in terms of doing FFS surgery, and that doesn't come from, being overconfident. It's just when you feel like something's right, something fits, it just makes a lot of sense. Like I said, when you realize that you were transgender, you realize, hey, this makes total sense. That there's no hesitation, about making the transition. And I kind of felt that with medicine and surgery. It almost feels like this is like what I was like meant to do.
Yeah, it's a complete slot in.
Yeah, and I have a lot of friends who are surgeons who never had no. Like for example, I'll speak about my spouse, my wife, who's a cancer surgeon. She never. There's no one in her family who went into medicine, and she never thought she would even go to medical school. And she went to college at UCLA, and after she finished college, she did a couple things here and there, and she realized, hey, I'm gonna go to medical school. And she didn't even realize that she wanted to be a surgeon until closer to the end of her medical school. And then now she's a cancer surgeon, but I kind of knew from very early on that this is what I was going to do. And I feel the same way actually with FFS surgery, that things kind of lead to your pathway. And I happened to train in Boston for some reason. And there's no hesitation, in terms of doing these surgeries, because it just feels like, feels very right.
It's just who you are. It's a part of you.
Yeah, it is really odd or weird kind of to feel that way. But when I even talk to colleagues, when they tell me I've known since I was 3 I wanted to be a surgeon, they look at me. That's kind of it's crazy that you knew that at the time.
They're like, that's kind of weird.
Yeah.
That's great. And I've actually heard this, that people perform better faster at whatever they're doing if they integrate that thing that they're doing with their identity.
Yeah.
So like you identifying as a surgeon before you had the technical expertise of the training and stuff, that already put you a step forward in being a surgeon. Mm-hmm. That's pretty cool. Let's kind of talk about the present day. Where are you at currently with your practice, and where are you wanting to take it in the future?
Yeah, we're always trying to get better, be better, do things more efficient. And actually, it's great when you have a large volume, because you can tweak things here and there. So my techniques are very different from how I actually did surgery 10 years ago. And there's also some techniques where I develop in response to what patients wanted. And I also adapt my techniques. One procedure that I developed about 3 years ago, because a lot of patients were asking me about, was they want their Adam's apple reduced, tracheal shave, but they didn't want an incision. And I realized I was doing a lot of facelifts for cisgender women, and I noticed when I was doing these neck lifts, I could easily access actually the Adam's apple pretty easily from the chin. And I was thinking one day, hey, I should be able to do this through the mouth. So, we started doing it about 3 years ago, and it's a pretty common procedure I do now. But your techniques kind of change or update based on what people want, but also figuring out better ways to do things. How do you minimize scarring? How do you minimize blood loss? So techniques continue to change. Mm-hmm. Several years ago, I integrated 3D printing in my practice, which I gave you a 3D model.
Yeah, I love that.
I realized, it doesn't matter how smart you are. It's still really hard to visualize a 3D object in a 2D space. So we started integrating 3D printing, and I used it during your surgery because I actually could touch and feel it, and I can see. I don't really need to reference actually CT scans in a 2D, flat
Right,
image.
because you have to like move it around
Yeah.
to 2D space.
So now I actually have a 3D model that I have, and it actually has all the structures and things like that. So a lot of it is, just being more precise with surgery, and also just understanding better, like what my patients want. Because there's a million different outcomes. So with every surgery, so it's important that you integrate, what you want, not necessarily what I want, but what you want in terms of the outcome.
Interesting. So on that topic, so when I came into Dr. Keojampa, I just said, do whatever you will because you're the expert and you will make me look great. I just have specific dysphoria around my lips or this specific item. And you've been really helpful in kind of like getting me to that place. But I'm wondering, when you have transgender patients come to you, how often is it a specific request versus like a more general request? And then how do you handle that? Do you make special changes based on their special request? Mm-hmm. Or do you make a more general adjustment based on your knowledge? Or how do you kind of balance that between their needs and your expertise?
Yeah, so I basically get two groups of patients. So the first group will know exactly what they want, and they'll tell me, these are the surgeries I want. And I follow, we kind of follow that list, and I may suggest some things that they didn't think about. And then there's some patients, I think more similar to you, where you say, just make me
more beautiful.
Yeah, yeah, as simple as that.
Yeah.
So in that instance, I try to also communicate with you, and it's actually great that we have such a, vast experience, because I have photos after photos and after photos, and I can show you thousands of patients, and a lot of times I actually can select similar patients that look like you and show you pictures of their outcome, and then get an idea of like if you like that or you don't. But it's really important to get your sense of what your ideal result is, even though if you give me all the full reins. We also do a lot of photo mock-ups of potential results, so I can communicate with you and you communicate with me what you want. Every result is pretty individual. It's really important that there's accurate communication. I could create a perfect nose that I like, but you may be super unhappy because that's not what you wanted. So even for patients who tell me that you can do whatever you want, or you just do what you think, it's still important that there's some communication that goes back and forth.
So that there's alignment of expectations.
That's correct.
Yeah.
But also I want to be able to achieve the result that you want, and sometimes I realize that I can't read your mind.
Mm-hmm.
So it's important that there's some feedback. There's some surgeons you'll meet where they have a clear vision of what they want, but they don't really care what you want.
Yeah.
So we try to align, what you want with what I'm capable of doing. Yeah.
I came to you just saying, I have a problem here.
Yeah.
Help me solve this problem.
Yeah.
And then you made a bunch of recommendations, and the main one was actually just the chin, which is why I came back. I'm looking forward to seeing those results.
Yeah.
I've been told that it's going to be perfect. So we'll see in 3 months how it turns out. A thought just came to my mind in terms of when you're looking at someone's face and working with it to create the symmetry, to create the look. How much does race and structure, like bone structure related to race, what's expected of the certain look of someone based on their race, how does that affect the way that you see someone's face and how you work with it?
Yeah, so definitely between races, gender, ethnicity, there are certain proportions and norms that are in those groups. And then also there are very distinct differences in men and women in terms of that. So you take a lot of those things into account when you're designing or trying to decide how to do someone's surgery. And then if you deviate anything more than say like 10 or 12 or 10 to 20% of what is normal, then for example, I have a lot of patients where even though they want to look feminine, they have a really recessed chin. And some of those cases, I will bring the chin forward just to basically balance out your face. But it's important that I bring the chin, when I bring it forward, that it meets basically, or it was within the proportion of someone of your ethnicity, but also the gender that you identify in. Mm-hmm. So it does change where I move like certain bone structures based on your ethnicity and also the gender identity.
Yeah, because I was wondering that I'm half Chinese and half British, so I'm like, how do you even find a norm for like such a niche category?
Yeah, I'd be surprised. I have a lot of patients exactly like you that are mixed race. So I sometimes look at those prior results and look at you and try to determine how best to do it. Mm-hmm. I mean, that's a great thing about being able to practice over a decade now and training for a long time. You have gone through lots of different types of patients, and it allows you to kind of guide you towards the future.
Yeah, good old experience.
Yeah, it is. Yeah, I've as things have gone on, like I said, you get better of every surgery. I try to tell patients that every surgery I do, I become a better surgeon. So I'm a much better surgeon actually, even from like 6 months ago. So like if you do have to wait some time, then you'll be definitely getting a better surgeon.
Do you ever feel like there's this moment where you've leveled up, and how does that become clear to you that you have leveled up?
I have surgeons that come visit all the time, and they want to be able to see the techniques I use, and I'm very open. Some surgeons, especially in the FFS community, are actually quite secretive about how they do things. Fairly open. I have residents all the time that come from Stanford. I've had residents come from medical school in LA, like USC, to come visit, and I've also had some visiting surgeons. They do mainly observe, but when they come see us, they see certain things that they've never seen before, or see how I do things where are a little bit different from what they imagined. And just for example, just recently, 2 weeks ago, I was doing the procedure I developed a couple years ago with the transoral trig shave. And one of the surgeons saw me do it, and he was like, I cannot believe that what you're doing is impossible. And when you document these things in video and things like that, so it's safe, or how people tell me, hey, it's not safe to do that, but it is. For example, when I was in training doing the type 3 cranioplasty, which we do very commonly, can seem kind of like out of this world that you're going to do a craniotomy in a patient, techniques kind of evolve, you get better at it, and then things that people thought were crazy or dangerous, you're doing it in a way that's super safe.
That's really cool. Really, really cool. So let's talk a little bit about specific things that trans people may have questions about in relation to surgery. So the first one is, what's your opinion on if surgery is necessary for trans folks? And do you think it's ever not necessary?
Yeah, I get this question a lot, because some of my patients wonder, are they vain seeking these surgeries? And how I'm actually able to justify a lot of these surgeries is I measure your face. I look at the proportions, and I look at, how does your facial proportion measurement deviate from the norm in terms of your gender identity. And oftentimes, I can measure some space and say, hey, you're off by like a good 10-15%. And this is actually why you're not happy about this feature. I can even cis women who see me and they're concerned about their jaw, and everyone tells them around them, like, hey, there's something wrong with you. But when you carefully look at their face, their jaw is like 20% larger than the rest of their face. So a lot of times surgery is justified because your features are out of the standard deviation, for your identified gender. So that, justifies surgery in one way. The second way is a lot of patients who are, trans-feminine or even trans-masculine, if your face does not, it's not matched basically your gender identity, you're not going to be gendered properly. So it affects your ability to work, ability to, function in society. I actually find facial surgery more important actually than bottom surgery. Several years ago, about 6 or 7 years ago, I was at a meeting with a bunch of insurance executives, and I was trying to basically advocate for why facial feminization surgery is so important, and actually more important than bottom surgery. And when I was, talking to all these executives, I basically said to them, hey, look, all of you on this table here could have had gender confirming surgery yesterday. And you know what? I would still gender you as a man, I would gender you as a woman, because basically I don't see your genitals. How you interact with most people is your face. So, and actually, by your face, I feel like the bottom surgery is, not as important.
Yeah, because you don't show your genitals to everyone.
That's correct, yeah. But also gender dysphoria manifests in a very, different ways. So there's no one right or wrong way. But it does justify why facial feminization surgery is, so important, right?
Mm-hmm.
Because if you could have, the correct genital parts, but if your face doesn't match, you're never going to be gendered correctly.
Yeah. Unless you just surround yourself with very specific people and that's it, but you can't avoid the public. It's funny, when I came over here last year, I was gendered incorrectly in line, and I was like, after FFS, I hope they gender me correctly.
And what is crazy, you bring out a point, because now you don't think about gender every day, right? So, because you're not getting this constant reminder about,
right now I do with my big ass chin, but I think that'll change shortly.
Yeah. So it's kind of that.
Yeah, it gives me my energy back to focus on other things.
That's actually what patients have told me. Once they've gotten that part out, they can focus on other things.
Mm-hmm. So I think one more question, because we're just about to hit time. I wanted to ask you about how you've seen other trans people finance surgeries and being able to afford to come to a surgeon like yourself.
Yeah, actually, this is actually very interesting in that I've had a bunch of patients who are actually high-powered, professional individuals like attorneys, things like that, and they come see me and they realize, hey, they can get a job somewhere that will actually allow them to have surgery. I actually had patient where she was actually an attorney, and she got a weekend job actually at Starbucks, which provides benefits to their employees for facial feminization surgery. And Starbucks is a very interesting institution in that a lot of cis women would go work for Starbucks because they wanted to be able to do IVF, which is in vitro fertilization, which is really obscenely expensive. It could be like $200,000-$300,000 to have a child. But cis women would go work for Starbucks, and they actually would provide that as a benefit for them. So you would see these actually high-powered women who have professional jobs. So actually my patient who happened to be an attorney did that same thing. So a lot of...
that's a good play.
Yeah. So a lot of my transgender patients, they either get a job somewhere that provides, this is a benefit. So that's a good way. And then obviously if that's not possible, then they either, self-finance it themselves. But there are definitely different avenues. The reason why facial feminization surgery has exploded is now that it's possible or reachable. When I was training 15 years ago, the only people who got facial feminization surgery were patients in their 40s, 50s, and 60s, mainly because those are the only people who had the means to afford the surgery. So now there's many ways to find financing or find coverage for the surgery.
Mm-hmm.
There's a lot more options out there.
Has that affected the affordability of it as more surgeons have kind of come to the forefront who can offer this? It's made the pricing lower. Is that what you're saying? Or
no, it's more reachable. Even if you don't have the economic means to afford surgery, you could work for a company.
Mm-hmm.
We have long spurts working with Amazon, where Amazon employees who are transgender, we've been able to work with their insurance. So there's many different ways to be able to get the surgery. 15 years ago, the only way that you could get surgery was you had to basically pay it yourself.
Out of pocket.
So there's many different avenues to be able to get there. I don't think that it's definitely a lot more hope out there than before, and there's many different ways. You can probably turn the lights on.
Oh, well, there you go. Well, that's probably a good time to close this episode. Thank you so much for taking the time to talk with me today and share some of your thoughts and opinions. And is there any shout outs or anything you'd like to say to the audience at home?
Not much, but I do have to get home to my wife and my kids. Since I've worked 6 days this week.
Oh my God!
I do service Monday, Wednesday, Friday, so they're probably awaiting for me to get home.
Okay, well, thank you so much, and we'll see you guys in another episode soon. Bye!